Very good morning, respected chairpersons and dear colleagues. So, actually, I do not feel so comfortable presenting this topic. When Shelvan sir told me to present this topic, reflexively I agreed. But then I understood that I am not a person who actually deal with a lot of ergonomic interventions. So whenever we do present a topic, either it's in shoulder ultrasound or ultrasound in general, or is it in cerebral palsy, there is a certain comfort range. But I am not feeling that comfort range because I am not a person who is doing a lot of ergonomic interventions in that real sense. But then what I felt and understood is that there are some basic things we all can ponder upon that will help us in the management of shoulder issues in general. So ergonomics is actually, you cannot say as shoulder ergonomics, precisely speaking. Ergonomics means it's actually the person, the man, the biological design and the biomechanics of the human body and the working environment and how these two are interacting. And that is a full process because it's not comes as packages of elbow joint, shoulder joint, elbow joint, hand or something. It is actually the man and the environment. So that is half of this thing will be medical and the half will be, you can say roughly that is engineering side, because you are modifying the workstation or modifying the tools, all these things that comes to the engineering side. But dealing with the human design and these things come to the medical, or you can say maybe of the side of PMR. So you cannot say basically it's only shoulder. I will give you just a simple example. You just squeeze your hand tightly, just try and squeeze your hand tightly, and at the same time if we keep our hand on our deltoid, we will feel that there is a small amount of contraction you feel at the deltoid. Okay, so that's just an example how our body, different parts of our body is interconnected. That is the bones, we know that there is a linkage between the bones, but not only the bones, the muscles and the fascia. Usually we try to overlook the fascia. So the fascia is also connecting the muscles, and through the fascia, even the muscles here that is connected to the hand. So the biceps power and the insertion, actually 30% of it, almost the 20 to 30% goes down through the bicipital aponeurosis and the investing fascia. So I am mentioning that because you cannot take it as a package of one joint ergonomics, that's a holistic thing. And when you actually say about ergonomics, these pictures come to our mind. We think of computers. The computer related pain, and the repetitive strain injuries. And whenever we take a session on ultrasound, we usually use these type of pictures to say that you have to have a better ergonomics, otherwise you will have neck pain or you will have wrist pain or something if you do not. So whenever you are dealing with some computer related device, some screen or something, and your posture and everything is very important, we usually use these type of pictures. And when you say ergonomics, these are the kind of pictures that comes to our mind, and these are the kind of news. Just 2 days back, these are the kind of news in the media that comes to our mind when we think of ergonomics. But that is not the only thing in ergonomics. This is also a human being. That is also a tool. There is also a working environment. Probably he is hunting for an antelope, or he is hunting a tiger or lion or something. So there is again a human being, and there is again a tool, and there is a working environment. But we seldom discuss of the ergonomic issues of such people. Okay, is it because they are underrepresented, or we are not concerned about them, or is it something else? So another picture. So this is an interesting photo. Actually, this is a tribe. This is a very virgin tribe in the Andaman. Usually, sometimes they are in the headlines. You might have heard of them, Sentinelite tribe. So that's actually a restricted area. Even 2 weeks back, a US vlogger tried to enter that area without authorization, and he is arrested. So they are a group of people who are actually retaining their community and their living lifestyle from the Stone Age, and they are exceptionally healthy people. Their health was challenged only when they were tried to civilized from the contact with the outer world. Again, focusing on this guy. This is a photo taken in the late 1970s. You can see his shoulder. You can see that shoulder range of movement and the way he is actually holding a heavy bow and arrow in his hand. So that shoulder ROM, we say that PROM, we say AROM, the passive range of movement and the active range of movement. This is actually a terminology, not a very common terminology. This is DROM, that's the design range of movement. That is a range of movement which a human being is designed to have. The shoulder he is moving, that is a normal range of movement. And then if we try to move our shoulder upwards, most of the time we will feel that you will not reach the 180. So to reach the 180, you will slightly use your trunk tilting. That is subjective. I may not reach, and I see that someone like Hafiza is already reaching 180 probably, she's trying. So that is the individual range of movement. Okay, so the problem happens that you have a design range of movement and your body and your muscles are actually designed to move in that range of movement, but your lifestyle have made something else that is an individual range of movement which is actually different from the design range of movement. So like a tire wheel in this thing, but like if you are not doing the wheel alignment regularly, the tires will wear and tear. Similarly, you have problems because your range of movement because your lifestyle that has changed. Again, coming to ergonomics, where are we going to intervene? You can intervene with the design of the human body, you can intervene with the workstation design. So let us leave the other thing for the engineers. Back to basics, my favorite textbook, and I do not know too many textbooks regarding posture, but I am now, I think, at this juncture, I am well satisfied with the Kendall. Okay, Kendall was our favorite textbook, and we share our time PGs like myself, Srijitsa, Shibi, all of us share an emotional relationship with Kendall. That's fairly because George sir had a Kendall, a handwritten copy of Kendall. We have seen that. Sir had a handwritten and beautifully drawn copy of Kendall, and it's a very nice book. I always tell my PGs to read it from cover to cover many times, and you read the muscle testing, but sometimes you ignore this posture area. So this is the ideal posture. Okay, so this ideal posture gives your muscles an ideal length and tension relationship. Whenever that posture is changing, you have problems. So that is the basic issue with ergonomics. Your design is getting changed to some of these areas. And this is known as the magic S. This is the magic curve ideally you are supposed to have. Okay, and this is the scaffolding. You can see that this is the natural and the proper scaffolding, your joint alignment a person is supposed to have. And when you are going back to that alignment, the thing is that you will reduce the gap between your design range of movement and the individual range of movement, and you can properly have your core muscles can have a proper function. If you see any cerebral palsy child, you will see that sometimes you feel that this child is having a problem with the upper limb. Even though there's a diplegia, you see that the child is having problem with the upper limb. But on proper examination, when you support the child's body, the trunk, you hold the child like this, then you see that his upper limbs are free. So the problem that happening is that your core muscles are substituted by your upper limb muscles. If you try to get up from the chair, if I say you to get up from the chair, majority of us we will use some amount of support to get up from the chair. Actually, we are supposed to do with our core muscles, but because our core muscles are inefficient, we do have help from our peripheral muscles. So this is a very common, if you just stand in front of a body size mirror and see, most of us will be having, I'm having this problem, I know that, our stooped shoulders, the flat back or sway back postures. These are the common things where actually the shoulders slightly come in front. So the problem happens, these posterior muscles are actually they are stretched and your anterior muscles are tightened. And what do they do? Then your scaffolding changes to some of these kinds. So if you see this, these are very common. Majority of us are standing in one of these ways. Or very, very minimum or very few number of people are in the ideal way. So majority of us will be in some of these postures. So You are supposed to sit like this, but you will be sitting some of these ways where you have a tilting of the posterior tilting of your pelvis, and there is an excessive flexion. So all that puts some of your muscles in tight. In this case, the anterior muscles are tightened, the posterior muscles are stretched. So the posterior muscles are weak and the anterior muscles are short. This is the way you are supposed to sit. So when you keep your hand like this, the shoulder like this, you have less tension on your wrist. But when you actually change your position, your wrist is in more tension, and there is more tension on the palmar aspect of your wrist. So what happens is, the person actually presents with the wrist issue, but the basic problem is usually coming from up, and that is the postural issue. So we need to correct the posture. So the basic principle is that the first thing you have to do is you need to correct the posture. So how are you going to correct the posture? So these are some basic simple exercises that you can do. This is this technique is known as the Egoscue technique, or the Pete Egoscue. So this is the simple technique where you actually put your pelvis into a neutral position, and you are doing some basic stretches. That you're doing it like 15 minutes 2 times a day. That will gradually put your body architecture, that postural issue, into correction. Again, Dr. Roy is not here, so he fondly called the first exercise as Pranjasana. He thinks that it is the way the Pranjatan falls in the movie. So, and these are the second thing. So that is basically what you are trying to do. The one thing about shoulder, if you want to know this one thing about the shoulder, you are trying to take the shoulder back. Most of the time, the postural issue is our shoulders are front. So it is in front. Our space between the subacromial space is slightly less. There are more tension over here, and the other issues associated with that. So that is a usual problem. So keeping it like back, that's a basic exercise. Any of these persons, and it's very effective. To make it more effective, actually, you can internally rotate both your feet, so that will provide some amount of tilting correction for the pelvis, and do like this. So that is one basic exercise. Even for the computer, who are using computer for many times, they can take breaks, they can walk, and they can do some kind of this exercise. And another practical tip is that always, whenever somebody comes with a problem, a work-related problems of the shoulder, always make it a habit to look at their scapula. Always make it a habit to remove the dress and see the person from the back. The scapula is going to tell you many things regarding the problem, pain of the patient and the shoulder of the patient. And you can even predict that he is going to have a rotator cuff issues, because the scapular dyskinesia is very common, and that is some correctable issue. Actually, you can teach them the proper postural things and the proper scapular muscle recruitment, and that will help them. So putting that shortly, I will say that in shoulder, if you ask one thing that I understand, and as I mentioned earlier, my experience is not relating to treating too many of the computer-related or work-related injuries, but we do treat shoulder issues, and there the most important postural issue that you need to correct is this forward, this protraction of the forward bending of the shoulders. And if you correct that along with your pelvic tilt correction, that will actually normalize majority of the postural problem. And when you come to ergonomics, always think that there is something known as the cognitive ergonomics, where you actually have the interaction of your workspace with your cognitive abilities. And there actually you need to have a better team. And whenever you mention some workstation, it's a very important point. You say that to some person that your work has got these problems and you have to change it like this. If that is not possible for the person, if that is beyond his control, that will only going to increase his pain. So always you must remember that there is something known as the cognitive ergonomics, that is how the workspace and the work environment interact with the cognitive abilities of the person. And so this is the one book by Pete Egoscue. There are 2-3 books. One is the Pain-Free, then one is the Pain-Free for Women, and this is the Pain-Free at your PC. It's not a medical book in the strict sense. It's actually something like a popular book, but it's a very nice book, very simple language, where you can understand some of the basic things. And one word of caution is that don't jump into a postural correction without learning the basics. Because you will have a tendency to do postural correction for every patient, and these patients, because any patient has any pain will have some amount of postural component, they will have some relief, you will miss. I have learned that lesson a bit hardly. You will miss some important things if you do not do a proper clinical examination, jump into a postural correction. So especially in the learning curve, especially in your residency period, don't get fascinated by a postural things, don't get fascinated by the manipulation, do the basic thing first, and the manipulation and postural everything comes only as an advanced thing. So that's all. It's a very brief presentation. I have shared some of my thoughts, to be precise, some of my thoughts. I hope that in some sense it might have helped you. Thank you very much.